This is the presentation of Nursing 8050 Health Policy Debate Presentation for Week 7, Senate 1. My name is Adrian Vieira Rivero, and I'm presenting the health systems of the United States versus Canada. Canada and the United States are very close to each other, but have very different health insurance and medical system breakdowns. The health insurance in the United States is largely purchased by individuals privately, employer subsidized, or government financed, such as in Medicare or Medicaid. With the establishment of the Affordable Care Act, they established marketplaces for purchasing healthcare insurance plans and actually penalized citizens and employers who do not have insurance. In contrast, the Health Insurance of Canada, they enacted the Health Insurance Act of 1984, which established universal health care for Canadian citizens. The health insurance is tax financed, public, and it has a single payer system, which is very unlike the systems in California, in the United States, in the sense that they can be private, they can be public, and there's a wide array of different health insurance plans and companies that provide health insurance to United States citizens. In Canada, health insurance is financed by income, payroll, and sales tax. There's no link whatsoever between employment and health insurance. So based on which is in the United States, your employment is often tied to your health insurance. There is no such link in the Canadian health insurance systems. It presents a very level playing field based on the tax structure of the individual and how much they pay. Conversely, in the United States, typically the more money you make and the more higher you are on the socioeconomic spectrum, the better health insurance you can afford. In terms of medical care, the United States typically is organized into primary, secondary, and tertiary care, depending on the complexity of the care needed. Primary care being for simple ailments, and tertiary care focusing on specialty and more complex care. The United States is very well known for its high-tech, specialist-focused care, which tends to incur more costs, but also gives the best levels of care in terms of specialty focused care and using the most recent high-tech systems and devices. Typically, the United States uses a medical care model that's more dispersed and less structured. Conversely, the majority of medical care in Canada is fee-for-service based. There are some difficulties obtaining prompt access because of the way the universal health system is set up. Typically, someone waiting for a hip replacement can wait up to 6 to 8 weeks to actually get their surgery. There are no itemized bills, so there is a less financial hardship by the healthcare consumers versus medical care in the United States is typically always itemized and can be very expensive and cause a lot of financial hardship for healthcare consumers. There are regulations in pharmaceutical prices in Canada, and so because of the single payer regulated systems, the care and delivery of care in Canada is more systematic and structured, and they can manage the cost better. That leads to my next point about cost control. Cost control in the United States is rampantly out of control. We try to structure our health insurance organizations and stratify care as much as we can into cost-saving organizational groups like HMOs and PPOs, which typically try to keep everything in the same network for insurance companies. But typically we have lack of adequate insurance and rapidly inflating healthcare costs that have spiraled out of control, that lead to people and organizations essentially leaving uh, healthcare consumers in having negative consequences for their healthcare. There's also a large amount of unchecked administrative costs that lead to a large amount of wasted expenditures that account for a lot of the waste and unchecked cost for the medical system. Conversely, in Canada, their reduced healthcare costs are, like I said previously, are resulting from a single payer system. There's less administrative costs in Canada. There's less high technology. There might be, um, for instance, you know, so many MRIs in a certain province versus in the United States, there might be 2 or 3 times as many MRI machines in that same vicinity. Canadian healthcare systems have less costs per day for inpatient care. The MD fees and pharmaceutical prices are all regulated and are less compared to the United States. This is just a very small sampling of the, the major differences. And for the sake of time, we will be ending this debate now. Thank you very much for your attention and have a nice day.